Hi, this is Deeana Jang. I'm the Policy Director at the Asian and Pacific Islander American Health Forum. Our mission is to improve the health and well-being of Asian Americans, Native Hawaiians, and Pacific Islanders. And we do that through influencing policy, mobilizing communities, and strengthening programs and organizations to improve the health of Asian Americans, Native Hawaiians, and Pacific Islanders. I would like to talk to you today about a critical domestic issue for our country, one that President Obama has made a key domestic policy for his first term in office, and that is the issue of healthcare reform. Our healthcare system is broken, and Asian Americans, Native Hawaiians, and Pacific Islanders, like the other communities of color, disproportionately feel the pain of this broken system. 1 in 4 Native Hawaiian and Pacific Islanders and 1 in 6 Asian Americans are uninsured. And when you look at specific ethnic subgroups, the uninsurance rate is even higher. For example, Korean Americans have uninsurance rates of 1 in 3. A lot of this is for a number of reasons, including the fact that many of our Asian Americans, Native Hawaiians, and Pacific Islanders either own or work in small businesses, doing low-wage work, where there's not affordable health coverage available, or their employers do not offer health insurance coverage. That's one of the reasons why healthcare reform is so critical right now, as the cost of healthcare keeps rising. We have several policy priorities for healthcare reform. And first of all, we know that coverage is not enough, but coverage is the first step to providing access. After we look at access to healthcare, we must be sure that the quality of care is responsive and meets the needs of our communities. Asian Americans, Native Hawaiians, and Pacific Islanders experience low quality health care. Asian Americans, Native Hawaiians, and Pacific Islanders are less likely to receive the prevention and screening for cancer and other preventable diseases. They're less likely to get counseling on smoking cessation and other prevention activities that will improve their health. So we do have some major policy priorities that we hope will address some of these issues. First of all, healthcare reform must include a robust public plan option. This is really important for the low-income families who are currently uninsured and not covered by the public programs, and as well as for the Asian American, Native Hawaiian, and Pacific Islander small businesses. There needs to be an affordable public plan option that will hold the private plans accountable and help compete with them to bring down the costs of healthcare. That is critical if we are going to address the rising costs of healthcare in this country. Secondly, we need to ensure that our healthcare reform is inclusive, and that there is fair treatment for everyone, regardless of immigration status. Legal immigrants work hard in this country, they pay taxes, they will be covered, they will be required under the healthcare reform proposals to purchase insurance the same as citizens. Therefore, they must have the same access to the affordability credits as well as access to Medicaid. Right now, under the current law, legal immigrants have to wait 5 years before they can even be eligible for the Medicaid program. We must urge Congress to remove that 5-year waiting period so that legal immigrants who have just arrived in this country have the same access to Medicaid as other low-income families in this country. Secondly, we have to ensure that all children are covered and all pregnant women. The public fully supports that we need healthy children in order to ensure that we have a healthy future for our nation. We need to ensure that all children have health coverage. The Children's Health Insurance Program reauthorization did a lot to cover many millions more children, but there are many gaps now, and there are many children who are still uninsured. We cannot let that happen. We must ensure that healthcare reform provides coverage for all children. We also want to ensure that there aren't any additional barriers placed on immigrant families to access the health insurance. So many immigrant families come in mixed status families where there may be some members of the family with different immigration statuses. We have a fragmented healthcare system right now where there are different members of family may be eligible for different programs and some may not. This does not make any sense. In order for a healthcare system to work, it must provide the entire family coverage. So we must ensure that there are no barriers for family members to get the coverage that they need. We must ensure that there are no additional unnecessary and costly and burdensome verification systems put in place. We already know from experience with the Medicaid program that when states have to spend millions of dollars to determine who in the family is eligible when they enter the country, if they have the right documentation, that it really hurts citizens and people who are eligible from accessing those programs. We need to ensure that our programs, our healthcare reform, actually encourages and helps enroll people and help them find the coverage that they need. In terms of access to quality care, we must ensure that the services provided by the health plans are culturally competent and linguistically accessible. We must require that health plans provide services that are culturally linguistically accessible. We must also provide more federal resources in terms of federal reimbursement for the use of interpreters and translators in all our public programs, including Medicaid, the Children's Health Insurance Program, and Medicare. Right now, we have 5 bills, 2 in the Senate and 3 in the House of Representatives. These bills must be merged in each of the houses and brought to the floor. At this point, the House bill is the only bill that has a public plan option in it. The Senate bill does not. We need to advocate to ensure that whatever healthcare reform bill passes includes a strong public plan option. We also do not have any language in any of the 5 bills that eliminates the 5-year waiting period for Medicaid. We must ensure that that 5-year waiting period is removed in Medicaid and to ensure that no additional barriers are put forward for immigrant families to enroll in these programs. So what can you do? We need you to be active, to tell your members of Congress that they must pass a health care reform bill that includes a public plan option, a strong public plan option, and that also treats legal immigrants fairly and does not provide additional barriers for immigrant families to access the coverage we need. We need to tell members of Congress that these services, that coverage is not enough, that services need to be provided in a culturally and linguistically appropriate manner. If you need more information on any of these priorities, I invite you to look at our website, visit our website at www.apiahf.org. Thank you very much for listening to me.